My name is Tiago, and I will be presenting this show entitled as Emotional Resilience in Nursing, a Framework for Managing Compassion Fatigue. So, compassion fatigue, it is a significant challenge for nurses due to the emotionally demanding nature of our work, and findings demonstrated how resilience building strategies enhance mental health and patient care outcomes. These are some of my work that I've been doing lately, and this presentation will introduce an emotional resilience framework to address compassion fatigue in nursing practice. So, results from prolonged exposure to emotional distress is important to understand and correlate with this compassion fatigue. And symptoms can include emotional exhaustion, reduced empathy, decreased job satisfaction. And these negatively impact mental health and patient care quality. In terms of the emotional resilience framework, there are four main areas that it is important to take in consideration. Self-awareness, which was the first article that I did in 2022, and is about how we recognize these emotional triggers and stressors. And in this little editorial, I do provide some tips how we can be more aware of our own emotions and how are we dealing with. Also coping strategies, so mindfulness, relaxation techniques, cognitive reframing, whatever helps the individual. And support systems, having these strong professional and personal relationships, friends, colleagues, family, partners, that in the end of the shift, in the end of the day, in the end of the night, whenever they can speak with this person and bond and depressurize. And also very, very important, work-life balance. Establish these boundaries and prioritize self-care. Emotional resilience in nursing is increasingly recognized as a vital component in managing compassion fatigue, which is a phenomenon characterized by this emotional exhaustion resulting from prolonged exposure to the suffering of others. Qualitative data from various studies indicate that resilience training can significantly enhance nursing's coping mechanisms, thereby mitigating the adverse effects of compassion fatigue. For instance, Osei et al. 2019 found a significant relationship between resilience and compassion fatigue among registered nurses, suggesting that resilience training could serve as an effective intervention to bolster emotional well-being in nursing practice. Similarly, other authors emphasize that resilience can act as a buffer against the emotional toll of caregiving, reinforcing the need of structured resilience training program. There are some case studies, and these are just two examples, that illustrate the positive impact of resilience training on nursing practice. For example, Metwally and Elsais in 2021 reported that educational programs aimed at enhancing resilience led to significant reduction in compassion fatigue and an increase in compassion satisfaction. The development of coping strategies through resilience training not only aids in personal well-being, but also enhances the quality of care provided to patients. And obviously, the peer support programs have emerged as a critical strategy in reducing burnout rates among nurses. And research indicates that such programs foster a supportive work environment which is essential for emotional resilience. For example, Zhang in 2023 highlighted that nurses who engage in peer support reported lower levels of compassion fatigue and higher overall job satisfaction. In a nutshell, practical applications of this presentation for healthcare leaders to develop this organizational resilience program, making sure that your institution, your clinical area is emotional healthy, for all the nurses to engage in regular self-care routines and professional development, and for educators to incorporate emotional resilience training into their nursing curriculum or emotional intelligence training. In conclusion, emotional resilience is essential for managing the demands of nursing practice. The proposed framework empowers nurses to overcome compassion fatigue, enhancing their well-being and patient care quality, and collaboration among healthcare organizations and individuals is key to foster this resilience. This is the reference used. Thank you so much for your attention. It has been a pleasure. Thank you. Thank you. These are my details. Any queries or any comments, please feel free to contact me on my email or my ResearchGate profile. Thank you.